Hello, this is Dr. Clark, and this is the respiratory system that we'll be going over today. So the main thing about the respiratory system is its primary function is to bring oxygen into the body through the lungs at the alveoli and to remove carbon dioxide out of the body. And this is what we call respiration, is actually this gas exchange, this movement of oxygen in and carbon dioxide out. So the respiratory system also works with the cardiovascular system to actually move oxygen out to the tissues through the blood, and then to bring carbon dioxide back to the lungs to be removed from the body as a waste through the blood. So the two work very closely hand in hand. Other functions of the respiratory system are going to be phonation, which is production of voice, like me talking right now. Dogs barking, cats meowing, those are some examples of phonation. Mammals do it, birds also do it, and these are in a lot of your different amphibians like bullfrogs, reptiles. So a lot of different land animals have the ability to do phonation. Regulation of body temperature, so it can help to keep an animal that is warm in a cold temperature by actually warming up the air coming into the body and making sure that it doesn't drop the internal core temperature of the body. Same time, it can be used to actually remove heat. So if the animal gets too hot, they can actually increase the respirations, like through panning, and remove excess heat from the body. Plays a very important role in acid-base balance, which is a separate lecture that we'll go over on acid-base balance. And it also plays a role in sense of smell. There's chemicals that come in, they actually attach to different receptors in the nose, and these receptors actually uh, give you that sense of smell. They actually detect that chemical, and they give the sense of smell for you or other animals. When we look at respirations, we have external respirations, which is the exchange of gases within the lungs. So oxygen uh, entering the bloodstream at the alveoli in the lungs, and carbon dioxide being removed from the bloodstream at the alveoli at the lungs. We also have internal respirations, and this is the gas exchange between oxygen leaving the blood at the tissue level and the cells, and carbon dioxide loading onto the blood. And so those are the two differences. So external is going to be in the lungs, internal respiration is going to be everywhere else that there's tissues at. External is going to be oxygen entering the blood, carbon dioxide leaving. Internal is going to be oxygen entering the tissue and carbon dioxide leaving the tissue. When we look at the respiratory system, we have what we call the upper respiratory tract and the lower respiratory tract. And the lower respiratory tract is everything uh, inside the lungs, and the upper respiratory tract is everything outside the lungs. Upper respiratory is going to consist of the nostrils, the nasal passages, the pharynx, the larynx, the trachea. They don't have it on here, but also the two main stem bronchus, or two main stem bronchi, the two little divisions off the trachea. They're very short, but they're outside the lungs, so they're all considered part of the upper respiratory tract. When we get to the nose and the nasal passages, you have the nares, which are the external openings of the nostrils. This is what allows air to come in and out and actually leads back to the nasal passages. Nasal passages is the space between the nostrils and the pharynx. So if you go from the outside of the nose back to the pharynx or the back of the throat, this is the nasal passage. The nasal passage is going to consist of the nasal septum, which separates the right half from the nostrils from the left half, the hard and soft palate on the bottom. You're also going to have the facial bone up here and some of your frontal bones and your maxilla that are actually going to make up the sides and top of the nasal passages. And right in the middle of the nasal passages, you're actually going to have turbinates. So these turbinates, there's going to be two of them on the right, two of them on the left. And if you remember from looking at them on the skeleton, they're going to be kind of these spiral shaped, that they just build these really big spirals. And they're going to be lined with mucosa, with pseudostratified mucosa that's ciliated and has goblet cells to produce mucus. And they're very important, these turbinates, for filtering the air and humidifying it and the sense of smell, all these different things, temperature regulation. And so they play a very important role with all that. Also, you have three main passages through there around the turbinates. The first one's going to be dorsally, between the dorsal turbinate and the facial bone. Second one's going to be between the turbinates. So there's a dorsal and a ventral turbinate here on this side. And then the last one's going to be between the ventral turbinate and the hard and soft palate. So those will be the three main passages. The thing to know about those passages is they don't really get filtered that much. The air is able to move through freely. If it goes through the turbinates, it's a lot more filtered. And these passages really aren't that large, but they allow for a little bit freer air movement. But there's other places we'll talk about where things can get filtered. So we're actually looking at them right here on the lining on the inside of the nose and the nasal passages and on those turbinates. You have that pseudostratified columnar epithelium. It's all ciliated. There's mucus on top. There's goblet cells. And right below it is this really big capillary bed. And so this capillary bed is very important for the functions that the nose is going to carry on in the nasal passage there. And so some of these is actually warming, humidifying, and filtering the air. So the blood is very important right there to actually warm up the air if it is cold outside. The other thing it doesn't say is that it can actually sit there and help cool down the air when the animal's hot. So it actually, or cool down the body. When the air goes by, it actually will sit there when it's really hot and breathing past the nares. It'll actually take air that's at body temperature and take the heated blood if it's like 100 degrees outside, and it'll actually take that blood will take that extra heat to the nares, and it'll help to blow off that extra heat out of the body. And then, of course, humidifies, keeps everything moist, because if the lungs dry out, you don't live very long, and so it's very important that the respiratory tract stays moist. The other thing it does is, with the filtering and stuff going on here, is this is where you get your sense of smell, is in the nasal passages. And it depends on the species. And this is because there's particulates that actually get trapped in the mucus. And there's going to be, and we'll get into it in spatial senses, there's actually chemical receptors that are going to sense what those chemicals are. And based on that, you're going to get a sense of smell. Some animals have a very strong sense of smell, like dogs or cats or bears, so omnivores and carnivores. Other animals don't as much, so us primates don't have quite as strong a smell, but we don't have quite the development of our nasal turbinates that these other animals have. You also have, coming off of these, the paranasal sinuses. There's usually two of these. You have the maxillary sinus and the frontal sinus. There, I should say, two per side. So you have a maxillary and a frontal on the right and a maxillary and frontal on the left. And these spaces do a couple of different things. One thing is they're air reservoirs, so if it's really cool, they actually help to warm up air and keep it at a constant temperature. If it's really hot outside, they actually can dilate with blood vessels in here. They've got the same type of mucosa on them that the nasal passages have, and the same capillary bed, so they can actually transfer heat to this air that's going to be exhaled. They play a very important role also in sense of balance. So if anybody's ever had sinus congestion or anything, your balance gets thrown off. Well, they work with what we'll learn later on is the vestibular system in the inner ear to work on balance. So they help you with your balance system. The pharynx is the common passageway for both food that's ingested on the digestive system and also for the respiratory system. And there's three different parts of the pharynx. The first one's going to be above the soft palate coming out of the nasal area, and that's going to be known as the nasopharynx. And then ventrally, where the mouth comes below the soft palate, is going to be the oropharynx. And so the soft palate actually divides the naso from the oropharynx. When you get beyond the soft palate, the whole area just opens up into one large area, and that's going to be known as the just plain pharynx. This separation is important because it keeps food from entering the airway. It also helps to keep air from accidentally getting into the digestive tract and actually causing bloat and other conditions like that. Some animals are born with incomplete hard or soft palates. We call it a cleft palate, and the problem with them is like when they go to nurse when they're first born, they swallow milk fine, but some actually gets up in their nose, and then when they go back to breathe, they actually inhale it, and they can actually get aspiration pneumonia and die from that. And that's something that we surgically try to correct. Pharynx actually has a lot of reflex controls, so there's reflexes for swallowing, there's reflexes back there for coughing. If things are caught in the back of the throat, there can be a gag reflex that can cause retching or vomiting trying to move it, or coughing trying to move it out. And there's a lot of actions that go on, so it keeps the swallowing reflex going and cutting off the airway whenever you're swallowing, or when you're breathing, it keeps swallowing from happening. And this is all through a series of reflexes that go on in the back of the pharynx to make sure that the two don't get crossed between food and respirations. The larynx is a short, irregular tube that actually connects the pharynx to the trachea. It's going to be made up of cranially the epiglottis, which is made up of cartilage with mucosa over top of it. And this actually folds back and closes over top of the larynx when swallowing in an area called the glottis, which is the opening where air actually moves through the larynx. And so its job is actually to fold back and try to protect the airway. You've also got the arytenoid cartilages that the vocal cords hang off of, cricoid cartilages, and thyroid cartilages. And actually hooked up to these is something called the stylohyoid bone or hyoid bone, which actually comes down from up around your mandible and actually connects to your larynx and actually helps to keep it in place. So the epiglottis is leaf shaped. It's got a rostral projection to it. So the apex or the point of it points rostrally. It attaches at the base of the larynx ventrally. And like I said, the important thing it does is it actually goes back and closes over the airway to protect it during swallowing. Also, you have the arytenoid cartilages that the vocal cords are going to be attached to. And there's pair. There's a right vocal cord and a left vocal cord. And these actually work together when you swallow. The thing that they do is they actually seal shut and they actually help to keep any liquids coming in. So there's actually dual protection here from both the epiglottis and the vocal cords, trying to cut off the airway from any food or water whenever swallowing occurs. The other thing that the arytenoid cartilages do is there's a lot of muscles and these vocal cords are attached to it with different tensions. And so they actually help in phonation. So they actually make vocal production through the arytenoids. And so when you look at them, they kind of stretch halfway across the lumen, one on the right, one on the left. And depending on the muscle tension, you get different vibrations as air passes over them. So what you're hearing me speak right now is actually vibrations of the vocal cords as air actually passes over top of them as I talk. If you have complete relaxation of the vocal cords, the airway opens up the glottis all the way wide. There's no sound that's actually made. If you have less tension, produces a lower pitch. So you'll find that testosterone actually causes lower tension or lessening because of the larger voice box, and therefore you have a deeper sound. In women underneath estrogen, the voice box is a little bit smaller. The tension on the muscles is higher, and so you get a higher pitch sound. And you can actually see this between males and females in species, and you can see it in different breeds of animals. You know, you'll have, it could be a female dog that's like a Great Dane. It's going to have a lower pitch bark than a male Chihuahua that's going to have a higher pitch, and part of this is the tension on the vocal cords is different just due to size. And then the prevention of foreign matters being inhaled is a big flow of function of the larynx. And it controls flow of air to the lungs and back, in and out. And it controls airflow coming in and out of the lungs. And actually it can make adjustments to the vocal cord to either open or close the glottis slightly, the opening into the larynx. And so this might be needed, like if it's really cold, the larynx will actually close off the glottis a little bit more to keep a little bit of that colder air from coming in. Or if you're exercising, it'll open wide open. The vocal cords will come all the way back, trying to let you get maximum airflow in and out. The trachea is a wide tube. It kind of starts at the bottom of your voice box, your Adam's apple. It goes down to about the area of your manubrium where it's actually going to split off into what we call the carina. They call it the tracheal bifurcation, but the proper name is carina, spelled C-A-R-I-N-A, carina. And there it divides at the carina into the left main bronchus and the right main bronchus, also known as the left main stem bronchus and the right main stem bronchus. These are very short, and these are going to go into the individual bronchi that are going to go to the individual lungs. And so its main job is to actually allow that air to pass from the larynx into the lungs and back out. And it's lined with ciliated epithelium. And another thing is to catch any particles that the nares did not catch. It's actually going to try to be caught within the trachea and those main stem bronchi. One thing about these is all these main stem bronchus and the trachea are all going to be made up of these cartilaginous rings with that pseudostratified epithelium on the inside and goblet cells making mucus. And at the top of this ring right here, it's C-shaped. There's actually smooth muscle. And so the body actually has some control over the diameter of the trachea. If you're exercising, that smooth muscle relaxes. It allows for maximum airflow. People that have allergic reactions like anaphylaxis, one of the things that actually happens is that smooth muscle contracts and it actually reduces the amount of air that's actually able to flow into the lungs. So the lower respiratory tract, the parts of it are going to be the individual bronchi going into the lungs, the bronchioles, the alveolar ducts, and the alveoli. So when we look at each bronchus, when it enters the lungs, they still have a bronchus or a bronchi still has cartilage in them and helps to keep them open. But as they go down and get smaller and smaller and smaller and they subdivide, it actually gets to where the cartilage rings no longer are effective to work because they're so small. They would be too large. And so you just have smooth muscle keeping them open. And so these air tubes that smooth muscle keeps open are known as bronchioles. So if you have a bronchi or a bronchus, there's going to be cartilage in a ring, C-shaped ring, helping to keep it open, just like we saw up here with the trachea. But bronchioles actually lack that cartilage. All they have is smooth muscle that keeps them open. One of the problems that you have, once again, with anaphylaxis or something like asthma is actually that smooth muscle constricts, and actually the problem is more in the bronchioles than the trachea because this is where it actually constricts and actually starts to shut off airflow. We have what we call the bronchial tree, which is these little bronchioles that are actually going to go into the alveoli, and they have these little branches coming off they call alveolar ducts, which are just little branches off of the bronchioles. And so these are going to go into a alveoli, which looks like a sack of grapes. And actually, when you look at an alveoli, there's actually multiple smaller alveoli inside each one of these grapes is an individual small air sacs. And both of them are known as an alveoli. But, you know, this bunch right here is going to have a whole bunch of these smaller ones. And all this does is it gives surface area in these alveoli right here for gas exchange, because around the outside of all these, you're actually going to have the pulmonary artery coming to an alveoli like this. It's going to actually go down into arterioles, which are going to turn into capillaries. So capillaries surround all this alveoli, allowing for gas exchange of oxygen coming on the blood, carbon dioxide leaving, coming into the alveoli to be exhaled. And then it's going to leave there through venules back to pulmonary veins, taking oxygen-rich blood back to the left side of the heart. There's autonomic nervous system controls the smooth muscle fibers in there for bronchodilation and bronchoconstriction. So dilation's needed whenever you're needing to move more air in and out, like exercise or fight or flight responses. Constriction is needed whenever you're in a dusty environment or there's something foreign there that the body's trying to protect the air passages from. Once again, these bronchioles are going to be lined with that pseudostratified epithelium that's ciliated, that's got mucus to try to catch things, filter them, and keep them from getting down in those alveoli. Alveoli themselves are very thin-walled. They're made up of actually, instead of ciliated pseudostratified epithelium, they become squamous epithelium. They're flat. There's a very thin layer of connective tissue underlying them with the capillaries. And so this very thin layer actually allows for a very easy exchange of gas, of oxygen and carbon dioxide. And they're lined with surfactant, and the surfactant is very important for actually keeping the alveoli open. If you don't have surfactant, the alveoli actually collapse and can no longer take in air. And this is the problem with premature births, is a lot of times the lungs are not developed to actually have surfactant to keep the lungs open. And so it's something very important to need. In human neonatology and premature babies, we actually use artificial surfactant. It's very expensive, and so the reason why we don't do it that much in veterinary medicine ends up being the cost of this stuff is so much. But this is how we're actually able to make babies that are born at 5 or 6 months actually survive, whereas 30, 40 years ago they would not, is because we've actually been able to make this synthetic surfactant to help open up their lungs. Each lung actually has a base, and so the base of the lungs are actually going to be down by the diaphragm, down by your stomach. And the apexes, or the points, are actually going to be up by your clavicles. The outside of the lung is going to be kind of a convex shape. The inside of the lung is slightly concave to make way for the heart, and the mediastinum in the middle. And so this is a set of rat lungs right here. And so you can actually see how the lungs curve around inside the thorax. You can see the mediastinum right here. You can see the base of the lungs where the diaphragm would be. You can see the apices up here, which is towards where their shoulders would be. They're divided into lobes in species. There's going to be 2 on the left and anywhere from 3 to 4 on the right. The book does say that horses have 1 big lobe on the left. They don't. They actually do have individual lobes. But when you look from the outside, just like with this rat lung up here, you can't really see a cranial lobe from a caudal lobe. And so in horses, what we end up doing is it looks like it's 1 big lobe, but it's actually 2. And they've got 3 on here. You can see the cranial and the caudal on the horse are fused as 1 if this was a horse, and then they have a separate accessory down here. But they actually have 5 lobes. A lot of species actually end up having 6 lobes. They end up having a left cranial and caudal, and then they end up with a right cranial, caudal, or cranial, middle, caudal, and accessory. The reason why there's only 2 on the left is on the left side of the chest is where the heart stays at. The lobes are distinguished actually by the branches of the bronchi going in from those main stem bronchuses, so you can figure out which are which by looking at that. And at the entrance of each one of these bronchi off the main stem bronchus into the lungs is an area called the hilus, which we've seen before being used as a description on lymph nodes. And on the kidneys, it's an indentation right there. And this is where the bronchi are going to actually enter in with air, but also where lymphatic vessels and your blood vessels and your nerves all enter the lungs at, is through this hilus. Pulmonary circulation, this is going to be carrying deoxygenated blood, is going to actually enter the lungs through the right side of the heart and through the pulmonary artery. And there it's going to circulate to the capillaries at the alveoli. There's going to be an exchange of gas there where carbon dioxide is going to leave the body, oxygen is going to enter the body, and then from there it's going to circulate back around to the left side of the heart with oxygenated blood to be pumped out to the systemic circulation. So when we look at the thoracic cavity, you're going to have the ribs on the outside, you're going to have the thoracic vertebra dorsally, you're going to have the sternum ventrally. You can see here on the left side where you've got the cranial lobe, you have a caudal lobe, and then you have the heart right here on the left side of the chest. And in animals, you should only be feeling the heartbeat in dogs, cats, and your large animals over on the left side. You should never really feel it on the right because the heart is oriented to the left. Just like it is with you. If you go, you'll find out that most of your heart actually sits on the left side of your chest. Cranially, you're going to have the shoulders, potentially the clavicles, the manubrium up here. Caudally, you're going to have the diaphragm. And so these are the boundaries of the thorax. In the middle, you're going to have the heart, the thymus, the esophagus, and your major blood vessels like the aorta and the vena cava, all in that mediastinum space in between the lungs. Lining the lungs is this thin membrane called pleura. We've already seen it with the serosal linings of organs. And so you're going to have visceral, which is going to be along the lungs, and you're going to have parietal, which is going to be out along the thoracic wall. And there's a thin layer of fluid around the pleura, and really what it's there is it's actually to keep things from sticking together. It's allowing things to rub back and forth without any injury being done to the lungs. The diaphragm is a thin dome-shaped muscle. It's skeletal muscle, so it is underneath voluntary control. Most of the time, thank God, we don't have to think about breathing because the body does this automatically, but when we need to take control of breathing, we can because it is skeletal muscle. And it makes the caudal boundary of the thorax, and it is the most important muscle in respirations. When it flattens and contracts, it actually pushes the abdominal organs down. It creates space for air to come in or negative pressure. It rushes in. And then usually when it relaxes, it allows air to be, it reduces the space in the thorax. It allows air to be pushed out underneath normal respirations. The external intercostal muscles play somewhat of a role in this. During expiration, there's a little bit of a role of the abdominal muscles and the internal intercostals that will play a role in this. But for the most part, the diaphragm does the most work in respirations. Probably 90% of it or greater is done normally by the diaphragm. And it is the most fit skeletal muscle in the body. Second most fit muscle in the body, first being your heart, second is going to be your diaphragm. When we have a patient that we end up seeing a lot of those abdominal muscles being used, or those thoracic muscles being used, that's an animal that's in severe respiratory distress, because we should not be seeing those muscles actually being used that much. It should be pretty much the diaphragm. So if you're really seeing abdominal breathing or really seeing them use their intercostal muscles, then that's the sign that this is an animal that's in distress. And those muscles will wear out way before the diaphragm does. So there's an emergency you have to take care of. The process of, actually they say respiration, but should be ventilation here, so there's a difference. So respiration is the gas exchange at cellular level. Properly, ventilation is moving air in and out. And this is done through negative pressure with atmospheric pressure, where the lungs actually expand because the diaphragm makes more room in the chest by pushing the abdominal organs down. It enlarges the size of the thorax. This creates negative pressure and actually draws air into the lungs. That air is going to go all the way down to the alveoli, and then gas exchange is going to happen at the capillaries. And then once the diaphragm relaxes, that's going to shrink the space of the lungs and the thorax, and that's going to actually help push air back out the trachea and the airway, removing that carbon dioxide out. The other thing about this negative pressure of breathing is it actually also helps in moving blood through the veins. So every time you breathe, you're actually helping to pull blood up to the right side of the heart to be pumped over to the lungs. Inspiration is drawing the air in. So it's enlargement of the thorax by those thoracic muscles, mainly the diaphragm, bringing air in. And then expiration is actually exhaling the air. And most of it actually just comes from relaxation of the diaphragm. Sometimes you'll hear about people that are singing that they use their diaphragm to actually control their singing voices, and to some extent they do, but they're also using a lot of their abdominal muscles to actually help keep enough space to where the diaphragm can actually sit there and keep air in longer for a note and different things like that. Most of the time, if you were using just your diaphragm, it would exhale all the air back out once it fully relaxes. So most of the time, expiration is just strictly through relaxation of the diaphragm with very little other muscles being used. But we can use the abdominal muscles to actually help exhale out extra air, or actually to help the diaphragm when needed. We have some different volumes to talk about. So we have tidal volume. This is the amount of air inspired and expired in one breath. It varies depending on the animal's need, but usually we have a formula that we can actually look at. It's usually about like 10 mils per kilogram of body weight of air that's brought in is the usual tidal volume. Minute volume is the amount of air inspired and expired during 1 minute of breathing. And residual volume, this is the air that's actually left over after expiration in the lungs, the trachea, the nares, areas like that. That's residual volume. Also kind of known as dead space. It's just air that's hanging around after expiration, because you don't get all the air out. If you get all the air out, then you're in the vacuum and then you're dead. So we look at tidal volume. That's the amount of air in and out in one breath. Minute volume, it's the total amount of air that you breathed in and out within a minute. And residual volume, that's the amount of air after expiration that's going to be held around in the lungs, in the trachea, in your narrow passage, in your sinuses. Gas exchange is just simple diffusion of gas molecules across a gradient. So oxygen diffuses into the alveoli with inspiration, and carbon dioxide diffuses out. And how we kind of do this is through what we call partial pressure of gases. And so there's a higher concentration of oxygen out here in the air than there is in the bloodstream. And there's a lower concentration of carbon dioxide out in the air than there is in the bloodstream. So pretty much this is just simple diffusion. This is diffusion of oxygen into the blood and carbon dioxide out of the blood. It's just moving from an area of high concentration with oxygen to low concentration in the blood, and carbon dioxide from a high concentration in the blood to a low concentration in the air. When we look at it, atmospheric air at sea level is 21% of the air that you breathe in. At 760 millimeters of mercury is the pressure at sea level. The partial pressure of oxygen in the atmosphere is 159.6 millimeters of mercury. Carbon dioxide in the air around you is 40 millimeters of mercury, and in the bloodstream it's at 46. And so what you'll find out is that oxygen in your bloodstream is actually going to be at 114 millimeters of mercury in blood coming from systemic circulation, so in deoxygenated blood. So it's very easy at 114 millimeters of mercury for oxygen out in the air at 159 to want to jump into the blood. And then with the carbon dioxide, if it's at 40 millimeters of mercury out in the external environments and at 46 in your lungs, it's very easy for that pressure to move it out of the lungs into the air around you to be exhaled. And so this is what partial pressures of gases are. It's looking at how much of the oxygen is there, how much of the carbon dioxide is there, and which gradient do they have to move across in diffusion. And all it is when we're looking at partial pressures, once again, it's the diffusion. It's the fact that there's more carbon dioxide here, less here. Carbon dioxide moves this way. More oxygen here, less of it here. It moves that way. And that's all partial pressures of gases are. It's just actually putting a number to it to where we can actually measure it, which comes in important later on when we start talking about blood gases and things and anesthesia and surgery and critical care and vet nursing. Control of breathing is going to be done in the brainstem or the medulla oblongata. It controls the respiratory muscles. During normal breathing, when you're not thinking about it, your body can override it and start breathing if you think about it, but most of the time this just automatically happens in the respiratory center. And so inspiration, expiration, and holding breath, all these things are actually controlled in individual centers, can be continuously controlled for brief periods of time. We have mechanical control. These are actually stretch receptors in the lungs that actually limit how much air comes in for inspiration and expiration. And pretty much what they're doing is they're making sure that we don't overinflate the lungs or underinflate them and cause either the lungs to collapse or the lungs to actually pop. If you overinflate the lungs, you can potentially pop them. If you underinflate them, then you can actually cause those alveoli to collapse and surfactant to stop being produced, and then you actually get collapsed lungs and you can't get any air in and out. So these are very important impulses to actually have that are body protections. Then we have the chemical control system, and the chemical control system actually does how often do you breathe. And so there's these receptors that are in your carotid arteries and up in your brainstem that actually measure three different things inside the blood to see when do you need to breathe. And the very first thing that they look at is carbon dioxide levels. So carbon dioxide actually determines what your respiratory rate is going to be. You exercise, you increase carbon dioxide, your respirations go up. You stop exercising, you start to cool down, carbon dioxide falls down, your respirations slow down. There's two redundant backups to this. The second one is pH. So if your pH gets off, your respirations will go up and down to correct the pH. If you get too much acid, your body wants to breathe faster. You don't have enough acid, your body actually slows down. And we'll get into this in the acid-base balance lecture, but this is because pH and carbon dioxide actually have a direct relationship. As carbon dioxide increases in the body, acidity of the body increases. As carbon dioxide decreases in the body, your pH decreases. So they actually have a very important relationship. And lastly, there's oxygen. And so oxygen is actually the very last thing that drives respirations. And in most of our healthy animals, it's going to be carbon dioxide. Sometimes when we put them underneath anesthesia, we might have to fall back on pH or oxygen if we get them too deep, and the body will kick in then. And if you're relying on oxygen during anesthesia, you have your patient way too deep, because that is the last redundant system going. Where we really see this as a problem at is in people that smoke, because they actually burn out their carbon dioxide, they burn out their pH receptor, and the only thing they have left is the oxygen to make them drive. And so a lot of times to breathe, and so a lot of times they end up having a lot of respiratory issues because the main systems that tell you to breathe are down. Carbon dioxide and pH, they have burned them out, and they're relying on oxygen, which is the very last system. And when they finally burn out that system, they usually die of respiratory failure. So blood levels of carbon dioxide and pH are linked, like I said, and so increases in carbon dioxide triggers decrease of blood pH, which makes you breathe at a faster rate. Decreases in carbon dioxide level triggers increases blood pH, makes it more alkaline, and that actually triggers respiratory centers to actually slow down their breathing. So I've kind of said that already before, but just understand carbon dioxide increases, respirations increase. Carbon dioxide decreases, respirations decrease. Those are the main relationships, and that there's a direct. If your carbon dioxide increases, your acid's going to increase. If your carbon dioxide decreases, your acid is going to decrease. Hypoxia is lack of oxygen, and so if you have a hypoxic animal, you will find that they're going to try to increase their breathing to make up for that. But once again, that's usually when carbon dioxide and pH has failed, and so when you actually have these hypoxia triggers going on, you have a patient that's already in severe crisis. And probably the biggest thing that we see with this is either critical care on end-stage patients or really during anesthesia. This is really where we start to see it getting triggered. And so when we're down to it, we're in a patient that's already in trouble. So that is the respiratory system.